चलो आगे चलते हैं फिर. So this is our treatment of endophthalmitis. We saw the history, we saw the examination, we saw a B-scan of the diagnosis, and this is how we will manage with antibiotics and vitrectomy, depending upon the visual acuity. If the visual acuity is good and movements are finger counting, antibiotics, all routes, 3 antibiotics, observe for 48 hours. If symptoms worsen or do not improve, or if on the initial presentation only light perception is positive, then we will go for pars plana vitrectomy. It is a surgical operation. And other than that, if light perception is negative in all quadrants and no pain, then we will only observe. And if light perception negative hai, or painful hai, then we will go towards enucleation. Okay? So these are more or less all of the things which are involved in the uvea. These include the 3 types of uveitis: anterior, intermediate, posterior. These signs and symptoms of uveitis: synechia, hypopyon, sympathetic ophthalmitis, and then endophthalmitis. So inshallah next time we will begin with a topic. वो आपकी मेरे से बाद में decide कर लेते हैं. But here I would like to briefly discuss the differentials of red eye. Okay. So what is a red eye? Red eye जब हम कहते हैं, either the eye is red from any part. Lids भी red हो सकते हैं. The conjunctiva can be red, the cornea can be red, or they can be blood all around. So there are a lot of differentials. जो symptom red eye के. Let's add a symptom to this red eye. कोई एक symptom मुझे बताओ. Pain. So we have pain and we have a red eye. तो ये हम कहीं टाइप कर लेते हैं इनमें से boxes में. और what else can there be with red eye?
Vision.
Lacrimation.
ठीक है, 3 symptoms: vision, lacrimation, and swelling. So a red eye can present with pain. It can also present with a loss of vision. It can also present with swelling. इधर मैं लिख देता हूँ swelling. It can also present with swelling, and it can also present with lacrimation or even discharge. Lacrimation और discharge को हम इधर लिख लेते हैं. Discharge. Then we had a symptom of pain. और आखिरी क्या था?
Loss of vision.
Loss of vision. तो loss of vision का तो हमने एक ऊपर बना लिया ना case scenario. This was a red eye and it has loss of vision. तो हम उसको ऊपर डिस्कस करें. ये this is our box for lots of vision. मैं इसको fill नहीं कर रहा. क्या ये symptoms जरूरी तो नहीं है ना? They can be only red eye and one symptom. These symptoms can also be interconnected. So a person can have a red eye, he can have swelling, and he can have pain, lacrimation, and discharge. ठीक है. Pain, lacrimation, discharge, loss of vision रखना पड़ता है. Okay. So these symptoms can be interconnected. Now let's join 3 symptoms. Then you will tell me one diagnosis which comes in your mind for red eye. Okay. इसमें participate करें, जितना आप करोगे, it will be for your benefit. So one symptom is, let's connect lacrimation, pain in the eye, and red eye.
Conjunctivitis.
Lacrimation, pain, red eye. That's good. You have one diagnosis of conjunctivitis. उसी तरह, let's say we connect swelling, red eye, and loss of vision. What do you think we should have?
Keratitis.
Trauma.
Keratitis and trauma. That's good. Both are correct. Swelling, loss of vision. Now depends upon कि हम swelling किसको हम कह रहे हैं. So instead of swelling, eyelid edema. Yes. So while trauma can have eyelid edema, keratitis usually does not have eyelid edema. उसमें loss of vision जरूर होता है. So something जिसमें swelling भी है, red eye भी है, loss of vision भी है. These 3 things in one diagnosis. बताओ मुझे कोई diagnosis.
ग्लोकोमा में होता है?
ग्लोकोमा में eyelid swelling होगी?
Eyelid swelling तो नहीं.
नहीं होगी, बिल्कुल. ग्लाकोमा में क्या होगा? चलो, देयर इज वन थिंग एल्स. ग्लाकोमा की बात की ना, देयर इज पेन एंड देयर इज लॉस ऑफ विजन विद रेड आई. ये कौन सा ग्लाकोमा है?
एंगल की वजह
Acute angle closure वाला.
बिल्कुल, एक्यूट एंगल क्लोजर ग्लाकोमा. दैट्स गुड. सो रेड आई, स्वेलिंग एंड लॉस ऑफ विजन, ये किस में होंगे?
ये
थिंक समथिंग
trauma के
आउटसाइड
साथ ही
ऑफ
होंगे.
ट्रॉमा के साथ हो सकते हैं. आई एम सेइंग दैट्स गुड. ट्रॉमा के साथ हो सकते हैं. बट द ट्रॉमा कैन बी मैनीफोल्ड ना. ट्रॉमा में हमने कहा कि सिंपैथेटिक ऑप्थेल्माइटिस हो सकता है, एंड ऑप्थेल्माइटिस हो सकता है. तो lots of type of trauma. So one thing is trauma. We can say there is penetrating trauma, loss of vision, swelling, red eye. तो थोड़ा सा आई बॉल से बाहर होके सोचो. There is swelling. There is swelling around the eyes. There is redness of the eyes. There is loss of vision.
Allergy.
Allergy. Now allergy, it directly affects the eyeball. That is good. Allergy में we can have a swelling. We can have red eye. We can have loss of vision. Which kind of allergy?
Keratitis हो रहा होगा शायद.
Dermatitis?
मतलब
नहीं. आप लोग पहुंच रहे close. Allergies. What are allergies
orbital
classically called?
cellulitis.
Yes, orbital cellulitis भी हो सकता है, but in an anaphylactic reaction.
Okay.
Okay.
Local anaphylaxis में puffiness होती है. Bee sting में क्या होता है? चलो anaphylaxis बोल रहे थे. Bee sting में क्या होता है? Isn't there swelling, redness around the eyes, and loss of vision because of the swelling? ठीक है?
Swelling.
लेकिन पेन भी होती है. Yes, there is pain. उसको भी मैं भी join कर लेता हूँ. So someone else told orbital cellulitis. That's also very good. Orbital cellulitis में भी ये 3 symptoms होते हैं.
ये 3 होता है.
That is excellent. Orbital cellulitis. Orbital cellulitis. Orbital cellulitis लिखा है. चलो कोई नहीं. अच्छा, then pain and swelling. ये किसमें बताई थी?
बी स्टिंग के साथ.
Bee sting के साथ, बिल्कुल. So we have bee sting in which we can have swelling, loss of vision, pain. We can even have lacrimation and loss of discharge. ठीक है? देखो diagnosis बनते जा रहे हैं. Then lacrimation and swelling के साथ हमने क्या बनाया था? चलिए diagnosis बताओ. In this discharge, there is swelling and there is a red eye. ये चीज ऑर्बिटल सेलुलाइटिस में भी यही हो सकता है. दिस कैन हैपन इन ऑर्बिटल सेलुलाइटिस एज वेल. इफ इट्स माइल्ड, तो जरूरी नहीं है कि द आईज आर कंप्लीटली क्लोज्ड. ठीक है? और लेट्स जॉइन समथिंग एल्स. यस, बताओ. कंजंक्टिवाइटिस किसी ने दोबारा बोला है. यस, लैक्रिमेशन.
Conjunctivitis पे भी हो सकता है.
बिल्कुल. बट द स्वेलिंग इन कंजंक्टिवाइटिस विल बी कंजंक्टिवल swelling. Not lids in the structures. Yes, that will be chemosis. So lacrimation, red eye, and this loss of vision. This can also occur in conjunctivitis. And we said that pain and loss of vision will also happen. So these are more or less the differentials according to the symptoms. We have red eye and we have pain. And along with that, we have loss of vision. We can have keratitis, we can have acute glaucoma, we can even have conjunctivitis. क्योंकि photophobia का भी हमने एक box नहीं बनाया उसमें. We should have made that box. Similarly, if we have lacrimation, discharge, our first thing is conjunctivitis. If we have swelling around the eyes, then we have another diagnosis. So let's start with this diagnosis then. A patient presents to you with a red eye, with complaints of, forget lacrimation, with complaints of discharge. This is the examination of the patient. What do you see?
Mucoid discharge, redness,
Mucoid
conjunctiva.
discharge. This is not mucoid discharge. Why is this not mucoid discharge? You're absolutely right. This is discharge, but this is not mucoid discharge. Mucoid discharge is completely clear. Okay? It has a tinge of yellow in it. So it is mucopurulent.
Mucopurulent. जी.
Well, then we have a red eye, redness in the eyes. You see that we have a normal cornea. Our cornea is normal in this picture, is it not?
Yes.
So what is your diagnosis in this case?
Conjunctivitis.
Which type of conjunctivitis?
Bacterial. Mucopurulent.
Mucopurulent conjunctivitis. Yes, it can be bacterial in nature. That's good. You can also see that there is a circumciliary region in this area. It's also clear. Okay. So how will you treat this conjunctivitis? Briefly बता दो. Modalities एक बता दे बंदा. हम पूरा algorithm नहीं discuss कर रहे हैं यहाँ पे. We will discuss when the topic comes. अभी सिर्फ हम एक overview दे रहे हैं.
Antibacterial eye drops.
Eye drops, that's good.
Steroid?
And no, we do not use steroids.
Okay.
Because steroids, in this case, there is no impending danger to any structure of the eye, and there is no likeliness of fibrosis. Steroids हम उसी तरह use करते हैं when there's a damage that inflammation, there's a danger that inflammation will damage the tissue. In conjunctivitis, that is less likely. और अगर आप steroids देंगे, तो you know that steroids, they decrease the immune activity of cells. So you're basically giving the bacteria a chance to grow when you're giving them steroids.
Okay.
So steroids will not be used in this conjunctivitis unless there's a complication or uski treatment and management ke liye karna hai. So if someone said antibiotics, that's good. Antibiotic oil drops, antibiotic eye drops, antibiotic ointments. Then we will use artificial tears so that the eyes, they don't get destroyed. Then we will advise hot compresses. Then we will advise washing the eyes with normal saline, regularly washing the eyes, maintaining hand hygiene. Then if there's a systemic infection involved, for example, if the person has gonorrhea and he has gonococcal conjunctivitis, or if he has chlamydia and he has chlamydial conjunctivitis, so we will treat the systemic infection as well with systemic antibiotics. Okay? So this was our brief presentation of conjunctivitis. Now in a patient who has red eye and has pain, and on examination, this is what you see. What do you see on the examination? क्या नजर आ रहा है? चलो normal, abnormal, सारा बताओ. The abnormal will be marked with blue. Sorry, the normal will be marked with blue. So what's normal?
Cornea
the lid margin is
cornea
normal.
is normal.
The cornea is normal. Okay? You can see that the lids are normal. There is no swelling around the tissues. Okay? So what's abnormal? Not much. आप इतना कुछ लग नहीं रहा abnormal. True? You can see some swelling or conjunctival suffusion. The vessels, they're more prominent and there's a slight tinge of redness. And somewhat the pupil is dilated. थोड़ा बहुत pupil dilated है ना? This patient has red eye, loss of vision, and pain. This is his eye. And when you perform a gonioscopy मैं आपको दिखा नहीं रहा because it's very difficult to interpret. So this is an anterior chamber OCT. So this is the AOCT. This is the lens. Sorry, this is a cornea. These are the irides. This is the lens. So this was the examination of the patient. This is the anterior chamber OCT. इसमें आपको क्या नजर आ रहा है? One finding, just one finding.
That white spots anterior chamber में.
नहीं, वो तो फिर उसकी है ना OCT की वजह से. I will briefly tell you that the angles they are closed, almost narrow or closed. ठीक है?
Okay.
And when you perform the gonioscopy, you see that the angle is closed. So what does this patient have?
acute angle closure glaucoma.
He has acute angle closure glaucoma. How will you treat this patient? Drugs batao. Which drugs will you use to treat his glaucoma? Number one, I want the number one drug first.
Pilocarpine.
Pilocarpine. Pilocarpine is the most potent angle opener there is. Okay, it's a very strong drug. When there is acute congestive glaucoma, it's your first choice. You will first go towards pilocarpine. Pilocarpine. Then, which other class will you use? Prostaglandins. Then, which other class can you use?
Anti-muscarinic, beta 2 agonist.
Beta 2 agonist. That's good. Beta agonist use करते हैं, beta blockers use करते हैं.
Beta blockers.
Beta
Blockers,
blockers.
beta blockers.
Beta blockers
Beta
and
blockers.
alpha agonists use करते हैं.
Alpha agonist.
ठीक है. Then we also use carbonic anhydrase inhibitors.
Carbonic anhydrase.
Acetazolamide and bizolamide.
Acetazolamide.
Yes, that is the surgical medical treatment. Surgical treatment हम जब वक्त आएगा तब discuss करेंगे. So you have another patient who has red eye, he has lots of vision, and he has photophobia. This is what you see on the examination. What are your findings? What are your findings in this patient?
It does involve cornea.
It does involve the cornea. There's a corneal opacity. What else?
Redness towards.
Yes, there is extreme redness. There is, on the nasal side, generalized conjunctival redness or suffusion, and you can see, appreciate clearly this circumciliary, this ciliary congestion all around. Okay? Is there any discharge?
Yes, around the eyelashes as well.
Okay, so you say that this is discharge. Okay. This is not actually discharge.
Okay.
Yeah, actually, this is the staining. This ulcer has been stained using some material. Which material is commonly used to detect corneal ulcers or corneal lesions? Which is the stain? Which is the stain which appears green under blue light? ठीक है, चलो वो मैं बता देता हूँ. So this is also, this is actually the fluorescein stain to use होती है. आपने सुना है नाम fluorescein stain?
Yes.
ठीक है. जब भी corneal ulcers, corneal lesions को हमने mark करना होता है, or we have to demarcate them, the eyes are stained using fluorescein stain. जहाँ पे the corneal epithelium is abraded, जहाँ पे नहीं है, जहाँ पे कोई lesion होगी, the stain will stick there and it will form a pattern. This is not a good pattern, लेकिन ये है कि you can see that appreciate that there's an ulcer or a lesion over here. This is just the excess stain. Okay, बाकी there is nothing wrong, and थोड़ा सा वो देखने से पता लगता है, but you are right, you're good in picking that this is something. So this is अच्छा. Is there any hyphema or hypopyon?
No.
No, there is none. Does the iris appear normal? Iris, is the iris normal?
काफी छोटा है.
नहीं.
The iris is normal. The pupil is dilated. The pupil is constricted.
Yes.
Okay,
Constricted pupil.
The pupil is constricted. That is a good pick. The pupil is constricted. So what is your diagnosis based on this finding? These findings? It's a corneal ulcer. Okay? This is a corneal ulcer. The cornea is involved. There is ulceration, which is shown by the pigment, the staining. Okay? There is circumciliary congestion. There is diffuse conjunctival congestion. The eyelashes, they appear to be normal. There is nothing wrong with the iris. There are no synechia at the pupil. There is no hypopyon in the anterior chamber. You can appreciate the details of the iris through this part, but not through this part. Okay. Similarly, in this picture, again, what do you see? What are your positive findings? They're the same. Okay? There is a corneal ulcer over here, which is stained by the sodium fluorescein stain. This is the ulcer, small part of an ulcer. This is the larger ulcer. And there are also small parts of denuded epithelium. There is conjunctival or ciliary congestion over here. These are the positive findings in this picture. So this is a corneal ulcer. इसकी treatment भी वैसे करते हैं, antibiotics. But always remember, आपको इस बात पे fail कर देंगे if you write steroids in the treatment of corneal ulcer. ठीक है?
Okay.
तो ये आपने तस्वीरें याद रखनी है. This is just an overview. Similarly, we have a patient who has a red eye and he has swelling around the eye. This is on examination. What do you see?
Periorbital edema.
Periorbital edema or swelling. That is good. You can see how much periorbital edema or swelling there is. What else do you see? कि हल्की सी आवाज मुझे आई है इधर पीछे से. What else do you see? और क्या है?
Eyes to
Discharge.
क्या? Discharge. Okay, there is discharge. This is the discharge. What else? We have 4 minutes left.
Cornea is normal.
Cornea is
Dilated
normal.
pupil.
Cornea is normal. Pupil is dilated. ठीक है? It can be dilated. Whatever the reason is, it's dilated. The conjunctiva is suffused diffusely. It's red.
Mhm.
So on the CT scan of this patient, forget the arrows. Arrows को आपने नहीं देखना. There is one finding, one other finding. One other finding. What is that?
Proptosis.
There is proptosis. That's good. Which eye is proptosed?
Left.
The left eye is proptosed. Yes, the left eye. Because CT scan, whenever you're reading, you imagine yourself
Right
standing.
side up.
Yes.
Right.
You imagine yourself at the foot end of the patient. जैसे बंदा लेटा है आपके सामने. This is the left side. The left eye is proptosed. So you have a patient who has red eye. He has swelling around the eye. There is some loss of vision. There is pain. There is discharge. This is your find. This is your examination. This is a patient of orbital cellulitis.
Orbital cellulitis.
Okay? You can see orbital cellulitis. You can see the proptosis in the CT scan of this patient. Okay? So briefly, these were some important differentials of red eye. When we're discussing a red eye, these are the symptoms usually associated with the red eye. And depending upon the symptomatology, the clinical examination, and the investigations, we can form a diagnosis. Whether
लास्ट वाले का डायग्नोसिस क्या है?
this is orbital cellulitis. ये वाला ना?
Orbital cellulitis.
ऑर्बिटल सेलुलाइटिस. हाँ, जिसमें प्रोप्टोसिस है.
बिल्कुल. This is orbital cellulitis.
ओके.
हाँ,
इन सब के डायग्नोसिस एकदम बता दें.
मैं दोबारा
मैं
बता देता हूँ.
इस ऊपर से पिक्चर से.
This is conjunctivitis because of the discharge, the redness of the conjunctiva,
Discharge, red conjunctiva. Yeah.
the normal cornea, and the normal pupil. This is,
Okay.
there is pain, there is redness in the eye, and there is decreased vision, the symptomatology. On examination, we have a more or less normal eye, but on gonioscopy and anterior chamber OCT, we see that
Closed
the angle
angle.
is closed. This is acute angle
Acute
glaucoma.
angle glaucoma.
Similarly, our patient comes with red eye, pain, photophobia, and loss of vision. On examination, there is ciliary congestion. There is corneal staining, demarcating an ulcer. The iris and the anterior chamber are normal. This is a corneal ulcer. Similarly, we see a patch on the cornea, which is being stained by sodium fluorescein or fluorescein dye. This dye stains a patch of denuded epithelium on the cornea. There is ciliary congestion. This is also a corneal ulcer. In this, over here, we have a patient who has a swelling around his eye. He has pain. He has discharge. On examination, we can appreciate all of these things along with conjunctival suffusion. investigations, namely a CT scan, we see that this person, he has proptosis in his left eye.
Proptosis.
So this is orbital cellulitis of the left eye.
Cellulitis.
ठीक है?
Okay.
So this concludes our
Okay.
session.
Thank you.
अब अगला जो है, इनमें से कोई टॉपिक हमने करना है नेक्स्ट टाइम, और वी वांट टू डू स्ट्रेबिस्मस. ये आप लोग मुझे ग्रुप में बता दोगे, ठीक है? If you
Okay.
have any other questions, तो भी ग्रुप में पूछ लेना, because our time is up. और दोबारा मीटिंग में स्टार्ट करना नहीं चाह रहा. तो with that being said, आज का सेशन कंक्लूड होता है. तो क्वेश्चंस उधर ग्रुप में, और नेक्स्ट टॉपिक कौन से करना है ग्रुप में आपने बता देना, ठीक है? ओके गाइस, टेक केयर, अल्लाह हाफिज.
ठीक है.
Allah